So yeah, good morning. Thanks so much for joining me. Thrilled to be part of sort of an aware, shining a light on lung conditions and looking after our respiratory systems and optimizing our lung health. So I'm very much here as part of the Harnham Physio Clinic, and I'll talk more about them at the end. And yeah, we'll start. So let me check. Oh, he's got someone else waiting. Are you right to? Brilliant. Okay. Oh, I've got my dog coming in to say hello. Right. So how can respiratory physio support people with lung conditions? So just to give you a little bit of background about myself, I have been qualified nearly 20 years, which is scary, but I worked up in London for a good few years when I first qualified at the Brompton Respiratory and Cardiac Hospital, and then at Guy's and St Thomas's, and then at Southampton for about 10 years. And now I've come back to Salisbury because I live here, and work within the NHS and then a bit of private work at the end of the week. I want to go over sort of lung mechanics, so talk a little bit about what the lungs do normally, some self-help and education strategies, and then a little bit about breathlessness management, pacing, airway clearance, and then lots of sort of signposting and links, because this will just be a scatter of information which I don't want you to be too overloaded with, but I'll certainly signpost where you can then go and get some more reading done. So how can respiratory physio help? I think respiratory conditions is one of the most common reasons for visiting the GP, for instance, and of course in the acute setting it actually accounts for about 35% of all acute medical admissions into hospital, which is where I work at the moment, so the acute setting within A&E and the acute medical unit. And by lung conditions, that's a really broad spectrum of diagnosis, but along that we have COPD, so chronic obstructive pulmonary disease, bronchiectasis, asthma, interstitial lung disease, pulmonary fibrosis, and there's many more. So in your diagnosis spectrum of people in the audience, you may have some of those, none of those, but or just symptoms of shortness of breath. So physio and respiratory nurses, that's important to put that in there. It's very much a multidisciplinary approach to lung conditions and lots of help out in the community. So we want to sort of help with breathlessness management, pacing, and then airway clearance to then reduce the risk of sort of further infection and deterioration in lung health. So just a question to perhaps pose to yourselves, have in the back of your mind. This talks about COPD, which is one of the lung conditions, but there's this vicious circle, isn't there, of dyspnea is shortness of breath, excuse the medical term, but you can see there's a sort of vicious circle of limited mobility, lack of confidence, and then some social isolation, which can easily happen and has been more so over the last year, unfortunately, affecting mood. And then again, that shortness of breath is fed into becoming worse, and because of the lack of exercise, the fitness reduces. So it's a vicious circle, which is very easy to get into, and you may find yourself in at any time, or have been, or trying to get out of that cycle. So just very scatter of some background research of how it can help. We talk around pulmonary rehab a lot in the medical world and hospital and outpatient setting and GP setting, and that really is about education, self-help techniques, and an exercise prescription. It's often run by physios, but the research shows it's good improvements in functional capacity, exercise capacity, shortness of breath, quality of life, exercise tolerance, independence, feeling of well-being, and lower risk of hospitalisation, which again is super important. So to talk a little bit about your lung mechanics, I think before we need to go into looking at methods to try and reduce breathlessness, it's important to know what the lungs do when they're well. And we'll do some of this practice together in a minute, and I'll get you to be doing some nice deep breaths. But when we breathe in, it's an active process, and we have lots of respiratory muscles that are controlling our breath. When we breathe in, our diaphragm is a big dome-shaped muscle at the bottom of our lungs on the picture there, and that actually drops down to become more flat as we breathe in, and our intercostals swing the ribs out to the side. And then the expiratory phase, the breath out, is actually a passive process, and everything relaxes back down. So the inhalation is an active process with our muscles drawing in the air, and on the way out, It's a passive process of everything drawing back out. Why do we need lung ventilation? The main aim is to get our oxygen in to transfer around to our bloodstream, to be delivered to our vital organs and muscles. And a big part is actually getting rid of our carbon dioxide. So it's that balance of our gases within the blood. And it's done very intricately within the little alveolar pockets as the blood flows through the alveolar pockets, which are your air pockets right at the bottom of those lungs and all throughout, little mini trees. And where lung disease or lung conditions come into effect is some of those pockets can either be big dilated air pockets, you've got less surface area for gaseous exchange, and also you have phlegm down there on occasions that block up the airways, and indeed with asthma, a wheeze that restricts the airways. So lots of problems that can happen but aren't uncommon. So that's our main aims of ventilation. So we have an opportunity for help with breathing retraining. So muscles can be strengthened, muscle groups can be rebalanced, and there's an opportunity to help with some of that, because there's lots of feeding in elements to breathlessness, unfortunately, of breathing habits and poor breathing patterns, thoughts about breathlessness and anxiety, and then lifestyle, which we touched on before and we'll talk more about. And some of that is then about a fear of exercise, and then that sort of deconditioning of then not wanting to do it and becoming a little bit of a vicious circle. So breathing retraining, the things I'm going to go through is something called breathing control, which is super important, and that's going to be about our relaxed breathing, of trying to gain back control when we're feeling more breathless. Pursed lip breathing, blow as you go, which is techniques for when you're doing activity, pacing, and then positions to ease the breathlessness. So breathing control is probably one of the main things to take away from today, is just trying to get this technique sorted. And it's a focus on relaxed diaphragm breathing, often used in Pilates, yoga, Tai Chi. And it's reducing tension in the muscles of the neck and the shoulders, which often become overactive with shortness of breath. And it is a slow, relaxed, smooth breathing pattern. We are going to have a go at it. So I'd like you just to try and be in a reasonably comfortable position. I can't see all of you, but I'm going to actually, let me try and maximize my screen so I can see some faces. Yeah. So I just want you to have your hand on your chest and a hand on your tummy. Try and consciously relax your shoulders. You can have your eyes closed if you want. So get a nice comfortable position. One hand on chest, one on your tummy. So I want you to try and do a nice slow breath in through your nose, and at the same time try and imagine your tummy rising. Okay, so I think we automatically do a deep breath from our chest, don't we? But I want you to shut your eyes and just do a nice slow in through the nose and out through the nose. And I want you to try and, instead of this top hand moving, try and imagine your bottom tummy hand moving. So on the breath in, your tummy should rise, and on the breath out, fall gently. And the reason why that is your diaphragm sits at the bottom of your chest. If I move my screen down, your diaphragm sits here. When we take a breath in, the diaphragm flattens. When it contracts, it's flattening actually, rather than the other way. Sometimes people think it's coming up into their chest and you breathe from up here, but we want to try and improve our lung volumes right down the bottom. So I want you to take a deep breath in through the nose and allow your tummy contents to be swelling out a little bit. Okay. So this is technique. It's very difficult when you're on camera and you've got people watching you and you're on a talk, but this is the type of thing to be practicing when you're on your own, peacefully at home. Have a hand on your tummy, because I say that's key. And it's a technique that will come with time. You're not necessarily going to get it necessarily today, but the time to practice it is when you're in relaxed breathing patterns, when you're not short of breath, because when you're having those more panicky moments, when you've gone up the stairs or you've run for a bus, wherever you are on your spectrum of activity, this is the breathing technique that you need to have better control over and try and consciously think to do. And you need to be doing it when you're peacefully, restful breathing, as well as when you become a bit more short of breath. So try and practice this just in your own time. Really comfortable, relaxed shoulders. Try not to let these shoulders come out around your ears, and think of it as your tummy breathing. I'll talk later on about tummy breathing. And it's really trying to improve the lung volumes down the bottom of the lungs and use your diaphragm a bit more with your breathing. Okay. Right, I'm going to just minimize that screen again. There we go. Okay. Another technique is pursed lipped breathing. And there's this physiology behind this, and on your way out, on the exhalation, it's actually splinting open the airways lower down and provides them to be opened up a little bit if you're feeling a bit tight. And it is literally just what's shown in the picture. If you take a deep breath in, and then a pursed lip, as if you're about to whistle, but no sound comes out, and just gradually let the air come out, but through those pursed lips. It helps splint open the airways, and it is trying to calm those breathing patterns down. I think sometimes when people become a little bit more short of breath, they go to a pant, and it's really important to try and slow that down, less of a dry mouth, and try, if you can, to go in through your nose and then out through pursed lip breathing on the way out. You may have found that you adapt these techniques already. You know, the body's very clever and often shows you ways to do this without even thinking about it. So you may find you do that pursed lip breathing already when you get puffed, but it's a physiological benefit to try and splint open the airways a little bit at the higher part of your lungs. Another sort of technique or thing to think about is blow as you go. So this can be really good if you're thinking about starting a task, whether it be climbing the stairs or doing some gardening or coming from sit to stand, you know, again, depending on where you are in that spectrum of your breathlessness. So it's thinking about breathing in before you start a task, and then say if it was just coming up into standing, you take the deep breath in first, and then as you come up through the effort of the activity, you are doing a long blow out. I think a lot of the time people hold their breath with activity of trying to stand, and they put all their effort into their muscles and they're thinking, oh, I've got to just get up nice and slowly, I'm going to hold my breath. It's you know, counterproductive in a way. You really need to blow as you go. Take lovely deep breaths in before you start the activity, and then nice long breaths as you come out. Or if you're going up the stairs, you know, one step up for a breath in, two for the way out, next step up for breath in, two for the way out. Time it. Your expiratory phase, your breath out, should be slightly longer. That's why we want to encourage that blow as you go technique. Sometimes we patients and people, what we call breath stack, and just breathe with the top part of their lungs and don't ever get it all out. And that's really important because we've got big lung tissue right down to the bottom of our ribs at the back. It's really important to make sure we're using all that alveolar tissue that I showed you on that diagram before. Pacing. So this is around, you know, thinking about your rest, your activity, planning your activity and your energy levels in accordance with the shortness of breath. So just run through some of those questions in your mind, whether you think that that's something that is relevant to you, whether you you know, are harsh on yourself, and whether you'd be honest with yourself to think, oh yes, I do that sometimes, or and whether that relates to your shortness of breath and your energy levels and your fatigue during the day, rushing to get things done quickly. I mean, I can say, yes, that's me. You know, we're probably yes to a lot of them. But when you've got shortness of breath and fatigue to play into your lives, and some of these things become more difficult. So have a little, I don't need to read them all out, but have a little think about when of those are sort of relevant to yourselves. So pacing is about planning the activities and thinking for them more in manageable chunks. I think we're all rushing through lives. We've perhaps had a bit more time over the last year to reflect, haven't we? But we, you know, sometimes we need to take a step back and think about planning what needs to be done in a day and what can wait till tomorrow. And if you've got breathlessness and, you know, fatigue with day-to-day activity, sometimes it's just doing what needs to be done on that day and doing it in manageable chunks. And we want to try and avoid this boom bust cycle. And by that I mean, you know, doing some housework, a food shop, walking the dog, and then coming back and being completely exhausted and wiping out the rest of the day, and then thinking, I can't do those things ever again because I just feel exhausted, and you just get this negative association with doing all of those tasks. So it's being really aware of your own body, your breathlessness and fatigue, and gradually building up activities. And that's more important than ever at the moment, isn't it, after the last year, that I think we certainly within the acute setting are seeing patients who are a lot more, deconditioned from being much less active over the last year, sadly, and that's from no fault of their own. We were telling people to stay home and be safe, weren't we? But unfortunately the tail end of that is that people are showing less activity, and as we go through our years of advancing age, that people become more frail, and that's difficult for our breathlessness and cardiovascular fitness, but also day-to-day activities of getting out and about, which hopefully we're going to see improvements now going forwards, but it's gradually building up those activities again and thinking positively that you can do them. And we'll talk more about exercise in a minute, because that's got a big spectrum of what we mean by exercise. But so just think about that pacing of managing it in manageable chunks and energy saving techniques and relaxation, but also knowing your own body of when you need to take a break, so you can think positively of what that activity can be tomorrow. So another in the moment sort of pacing technique is thinking about that ratio of breath in to breath out. So when you're doing the activity of whatever it is you are, think about this, what we call the breathing rectangle is a good way of thinking about it. So we talked about the not just breathing with the top of our chest, instead using our whole lung capacity, and that's important with getting all the breath out on the way on the expiratory phase. So just again, practice this with me. So think about your rectangle, and you can have prompts around the house, can't you, of the television, the oven door, whichever it might be, or just think of a rectangle in your mind. Think about breath in for 1 and out for 2, the ratio of 1 to 2. It might be that you can do 3 seconds on the way in and 6 on the way out, depending on your breathlessness and your pattern of breathing, but the breath out should always be longer. And again, if you're climbing stairs, in for 1, out for 2, in for 1, out for 2. And that expiratory phase is that really important, trying to empty the lungs to allow a really good healthy breath in for the next phase of your breathing. We don't ever totally empty our lungs. Our lungs are beautifully filled the whole time, but it's more about that gaseous exchange, about fresh air and fresh oxygen coming out and the clearing out of your carbon dioxide. This is a really good, so the calming hand is a really good sort of physical adjunct. We've always got a hand with us, haven't we? That you can use as a prop, and a reminder technique with breathlessness, that whether it be around the house or if you're out and about and feel panicked because of your breathlessness, you've always got a hand with you. And this is, you'll see lots of literature about this. You can Google calming hand. And it's just a recognition. The first is grabbing a thumb. So you can have your hand out in front and try it now. So grab your thumb, and that's a recognition of, oh, I'm feeling really tight, or I'm feeling really short of breath, I'm feeling a bit panicky. Grab that thumb, hold it firmly. Number 2 is going over to that first finger. So you can either, a nice way of doing it sometimes is use your finger along, like it's a ski slope going along like that, or you can just come onto that next hand and grab it, next finger and grab it. So your forefinger is sigh out. So relaxing your upper chest and shoulders. That's really important. We talked about that expiratory phase. And the next one, going over to that middle finger, is inhale. So a nice, slow, deep breath in through your nose. Again, that's the time you can shut your eyes to take the world out, whatever you fancy. So nice, slow, gentle breath in through your nose. And then 4 is that nice, slow, relaxed breath out. And that might be when you're using that pursed lip breathing. It might be that you just want to go out through your nose, depending on how short of breath you are. And then the 5th, the little finger, is, they say, do a really lovely big stretch of your hands. You either do a star and then back into a fist, or another star, but it just takes your mind away from the panic of your breathlessness, or where you're at with your breath, whether I'm in or out or whatever, but just takes it over to that hand. And then you can start again from the thumb, going all the way back through until your breathing calms. We sometimes rush through life and activities and get panicked with these moments of breathlessness, and it's just bringing it back down to something, a prop that you've got always on you, to think about those breathing patterns and some of the techniques that I've showed you. Okay, positions to ease, and this is again super important for your adaptations of daily life, and we use these in the hospital setting through to if I've done a run, you automatically come forwards with your lungs. So you may well have found you find these positions naturally at home. When you're puffed, you lean forward onto the table, or indeed back onto a wall. And what that is physiologically is it's offloading these accessory muscles around our neck and shoulders that get hyperactive when we're short of breath. So when you're puffing, when you're panting, your shoulders come up round your ears and shorten, and then we're using just this tiny little bit of lung up the top to breathe, rather than that whole lung capacity that we've got. And these positions optimize the diaphragm and your tummy coming out the way, to allow the diaphragm to drop down much more easily, and allow your shoulders and what we call accessory muscles to be offloaded and relaxed, which is really, really important. So if you take anything away from today, think about breathing control, as that tummy breathing we talked about, and positions to ease. And I say you may have adopted some of these positions already when you're feeling puffed, but for good reason. You know, you need to offload and relax this upper body when you're feeling short of breath. So active cycle breathing technique is important for us from a physio point of view, and some of you may have phlegm, some of you may not. Secretions are something that lung disease it comes alongside with. It's very normal. Some people will have phlegm every morning, evening, and that's okay for them, and that's what their lung condition will predispose them to have a certain amount of phlegm, and that's normal and that's okay. What we want to try and avoid is it becoming too stagnant down there all the time and not being cleared out efficiently with a cough, and sort of brewing down there, which can then predispose to infection. So it's important that the phlegm is coming up as much as we can, but it's also important to remember that certain amounts of phlegm is normal for lung conditions. So it's a cycle, and again, I've got some links on the end of the presentation with much better or more detailed information sheets about this, but it's a cycle of breathing control to start with. And again, let's have a go at this now, because it's important that you understand the cycle. So the breathing control is that tummy breathing. So again, have your hand on your tummy and just do 2 or 3 really slow, relaxed tummy breaths for me. So in through nose and out through your nose. And these don't have to be particularly big ones. They're just nice, slow, calm tummy breaths. And this is for you to just get in tune with your breathing and relax into a comfortable position. This should be done seated and reasonably relaxed. The number 2 is the 3 to 5 deep breaths. And this is where we do encourage you to use your rib angles a little bit more, and ribs swinging out, and a deeper breath from your chest, because we're trying to get the air right down to the bottom of our lungs with a bit more effort. So we talked about the inspiration being an active process, so we can do a much deeper breath when we need to, and this is where we would ask you to get a really deep breath in. And again, we'd ask to go in through nose, but a much deeper one. So, and you'll feel the lungs, you'll feel your ribs rising, and also try and imagine your diaphragm dropping down, so we can increase our lung volumes from the ribs coming out, but also that diaphragm coming down. So you'll feel both sides now. So deep breath in, and then on the way out, just let it go and consciously relax your shoulders. We'll do 2 or 3 more. And then really sigh on the way out, so it's all coming out. Good, 1 more. You might hear a bit of a rattle if you've got any phlegm there that's ready to move. And then it's important just to have 1 or 2 of those tummy breaths just before we go on to the huff, just so you're not feeling dizzy, or sometimes people take those deep breaths too quick. So just come back to the slower tummy breaths just for 1 or 2 while I'm talking. And then we're going to do what we call a huff. So again, this is a really important technique to take away from today. It's a expiratory, it's a forceful breath out, essentially. Imagine you're steaming up a pair of glasses that you're about to clean, or a mirror that was in front of you that you were steaming up to draw a face in. So a deep breath in, and and you want a wide mouth, and as if you were forcing the breath out. I'm going to move on to the next slide because there's a picture of it. You can see the diaphragmatic sort of form of it there, but what you're aiming to do is try and get a more of a forceful breath out. And it is important that it's through a wide mouth, like you're really steaming up a pair of glasses to clean. And that's what that's doing, is trying to bring the phlegm up towards your bigger airways at the top. You can see in the diagram those arrows and congestion is trying to move up towards the bigger airways, and the little arrows pointing to it. It almost does that with the airways to try and bring it up towards the bigger airways at the top, to then make your cough much easier, because you may struggle with coughing a lot and getting exhausted with that. And sometimes it's that we're not doing those deep breaths first to get the air behind the phlegm down the bottom of the lungs, for 2 or 3 or 4 breaths as we need to, and then the huff is trying to sort of collect up that phlegm that's moving in the alveolar and bring it up to the top of the airway. And then really the cough should just be the last bit to clear it into a tissue or pot or swallow, whatever you do. There's a couple of different techniques that you can do. A smaller breath in with a long huff really uses your tummy muscles, and it tries to recruit the phlegm from the lower airways. It can be quite hard on your tummy, so if you try it now, quite a small breath in and then a long huff, so and you almost feel like you're putting quite a lot of effort at the end, but that's actually recruiting some of the phlegm that might be deeper in the airways. And then the one after that can be a big breath in and a shorter huff, and that's really just if it's at the top. You'll be starting to get used to, if you hear phlegm, you'll be starting to get used to where you feel it in your chest. So have a play around with some of those small breath in, long huff, or big breath in, short huff, to where you feel it is in relation to how ready it is to come out. Let's just go back to the ACBT. So I'd say, yeah, 2 or 3 huffs really. We don't want to get too wheezy. So again, listen to your body, listen to your lungs. Sometimes the huff can make you a little bit wheezy because you're putting in quite a lot of effort. And if you need to, go back to that breathing control. And as I say, the last little bit should just be the cough to try and get that phlegm out into the, into your tissue or pot. Don't worry too much if you're swallowing it. Don't forget it comes up to the back of your throat, and actually a normal physiological response is to swallow. That's our gag reflex, and it just goes down into our tummy and out the other end. So people worried, oh, I don't want it going back down, but if it's generally come up into the back of your mouth and then you're swallowing it, it's just going down into your tummy and out. Equally, sometimes people like to get rid of it into a tissue or a hanky, whatever you're used to. So that's just a good breathing exercise, as we call that, and it's called ACBT. You can do 2 or 3 or 4 cycles of that in the morning until you feel like you're clear, as many times a day as you feel like you need it. We say morning and evening because morning you often wake up feeling a bit congested because you've had a night of lower lung volume breaths, and it builds up a little bit. And you can do 2 or 3 cycles of that until you feel like you've cleared, or you're tired, or you don't feel like there's anything to clear. But it's a really good pattern to get into, to try and have a bit of a routine of your breathing exercises to maintain that phlegm clearance. So we talked a bit about the huff, and there's some more literature on this at the end and some signposting. So I think the last little couple of slides is just about exercise with lung conditions. So I've did a mini list there. I mean, that's an exhausted list, not an exhausted list rather. Exercise can mean different things to everybody. So for some, it might just be a walk in the garden. It might be doing some housework. It might be climbing the stairs. But for some, it might be cycling or on an exercise bike or a little gentle bike ride. It might be Pilates. It might be Tai Chi. It might be ballet. It might be dancing. It might be classes. We're starting to see all of these classes come up now, which is brilliant, and be started again. And I know Alex Taylor's doing some wonderful classes as part of the week, and she's got a seated exercise class, I think, coming up, which is amazing. And she's a wonderful lady, and I did my baby buggy fun classes with her with my first child 10 years ago, and she's absolutely incredible. She's now heavily pregnant with her 4th child, so she's amazing. So that is well worth doing that if you can. So it's about staying active, staying well. We talk about healthy lungs, healthy heart. We'll talk more about the benefits in a sec, but I'd stay here, that disclaimer, you obviously need to listen to your own bodies and be advised by your medical professionals. I don't know your medical history, all of you yourselves, so talk to someone, medically professional before starting things. Make sure you listen to your body and be aware of your symptoms of any dizziness or chest pain, or all of those symptoms are very important to listen to. And if you're concerned at any stage about even thinking about exercise, and talk to either your GP or the leisure centre actually has lots of wonderful classes that are starting up, or indeed these amazing community setups that Liv's involved with. There's always advice out there. So the benefits of keeping active, I mean, a physio could talk about this all day, but they are some of the things listed, particularly for lung disease. We are improving the strength of breathing muscles. We're improving strength of our peripheral leg muscles, but all those muscles I've talked about around your lungs that help with our lung breathing patterns and mechanics, all of that can be strengthened. And of course, the fitness of our heart and lungs and the efficiency of how we use our oxygen, and that goes down to the vasculature in your lung, your cardiovascular disease risk is reduced massively by exercise, and the fitness of those heart and lungs is hugely important. And as I say, research has shown that patients or people have much less feeling of shortness of breath as they become much fitter, which, going back to that vicious circle of anxiety and mood and isolation, it can only be beneficial. Improve bone and muscle strength, less risk if people are doing gentle impact exercise, and that may just be walking. That has proven to show less likelihood of developing osteoarthritis in the weight-bearing joints. Helps maintain a healthy weight, which for lots of reasons is important. And then higher energy levels, better sleep. So looking at those, holistic things that are important to us in life. We all want to have a good night's sleep, and we all want to feel like we've got some energy on board. And then reduce stress and blood pressure. And then looking into, as we advance in our ages, less risk of fall because of all of those things as well. And there's lots of reading on the British Lung Foundation.org.uk, which is a wonderful website. So I think, yes, that is on to just links. So there's some links there that I think, if this is being recorded, then you'll be able to either go back to it, or I'm very happy to email this out as an email form, whichever is easier. They should be able to just be click and copy and paste to be able to look at all of those, but again, I'm very happy to email out a Word document of things if people would like. The COPD app is also a very good app that can be found on an electronic device or phones if people are technically savvy, and if that's the condition that you have. Yes. Oh, and then very importantly, so just to talk about the Harnham Physio Clinic, which is a superb clinic that we're very lucky to have in the Salisbury, central Salisbury area. They've done amazingly with lots of awards over the last couple of years, and we're all HPCP registered, and there's a real selection of community services and musculoskeletal services. So there's myself that does the respiratory physio, but I'm a tiny part of a big clinic, so there's lots of community services that look at post-hospital stay patients, improving mobility and functional strengthening exercises, falls prevention, and then a big part is the musculoskeletal physio clinic, so your backs, your hips, your knees, the walking wounded, and they do marvellous acupuncture and massage therapy as part of that holistic care. And I think, yes, that's me.